Jackson, Executive Director of Russell Medical Foundation, and we could not be more proud to be partnering with the Auburn University School of Nursing for the CHAT program.
Well, I'm Jack Court. I'm the Rehab Director at Russell Medical Center, and Kara Tidwell is our Fitness Coordinator. And we're involved with strategic planning for growing community health and wellness. And when we identified needs related to adolescent teens regarding childhood obesity and health knowledge, it was a perfect partnership when we were approached by Auburn University to help sponsor TigerCHAT. And that's kind of our world. We really want to see the hospital's objectives in the community at this level, so that it's very dynamic and active and engaging, and try to make our community more active and more healthy. And we start at this age, and this program will grow, and we're very happy to sponsor it through our foundation program.
And I'm Kara Tidwell, Fitness and Wellness Coordinator at Total Fitness at Russell Medical. And I think we've been open for, our new facility's been open for 14 years. And since then we continue to offer programs and just try to increase education within the community about health and wellness of all ages. So I think that this is going to be an excellent opportunity for us to partner with Auburn University.
This is the first year, the first opportunity that we've really had to partner with someone at a 4-year span. So this is a 4-year commitment that Russell Medical Foundation has made. It is also a $40,000 commitment. So we're just excited to have Jack and Kara at the front of this and working with Linda Gibson Young and her staff to make this happen. And I just think it's a win-win for the community. Thank you so much.
Thank you.
Welcome into another edition of TPI Talk. My name is Scott Hardy, and today we have a very special Medical Minute edition of TPI Talk, as we'll be interviewing the director of TigerCHAT, Dr. Linda Gibson Young. Dr. Young, thanks for joining us.
Thank you. Glad to be here.
Yes, ma'am. So can you provide some insight into the background of the organization and the program and what your role is with it?
Sounds good. Yes, TigerCHAT stands for Community Health Awareness and Training. And we wanted to impact the children at the school system because they spend so many hours throughout the day. And we want to make them aware of their body and taking care of their body. So TigerCHAT was designed by a team of pediatricians, nurses, the school board, the hospital center, and we identified the need to really focus on nutrition, increasing activity, lung health and staying healthy, asthma and allergies, and dealing with our emotions. So the conversations took place at around a table where we recognized the need to really impact school children where they are. So we partnered early with those organizations and discussed a curriculum that we could use with these children.
Yes, ma'am. The program is being housed at Radney Elementary here in Alexander City, and is there a reasoning behind targeting 5th and 6th grade students?
Definitely. 5th and 6th grade students are now taking more responsibility, and they're transitioning to the point to take care of their own health. So it is the children that are in the 5th grade level, 4th, 5th grade level, where they start to recognize this is my responsibility to take care of my body. So we wanted to just impact them at that point. So 5th grade children, 6th grade children at Radney Elementary are the only children within that one school system. So that enables us to come in and work with them at their level. And 5th graders are ready for this discussion.
Again, we're here with the program director for TigerCHAT, Dr. Linda Gibson Young. And Dr. Young, again, we're talking about partnerships. Can you discuss the relationship between Russell Medical and the program itself?
Yes, Russell Medical Center and Russell Medical Center Foundation have played a vital role in TigerCHAT. They have funded TigerCHAT for us to design the program, for us to have nursing students work in the Alexander City area, and they have taken a big role in helping us understand the community and understand the population of Alex City. We've enjoyed designing the curriculum around the needs for the students, particularly of Alex City.
Dr. Young, we appreciate you joining us today and allowing the students here in Alex City to be exposed to such a great program. I think a healthy lifestyle is something that we can all get on board with. And again, for all the partners that are involved, we appreciate them as well. And following this interview, we'll have some other segments in this edition of TPI Talk with some of the other partners. So, Dr. Young, thank you again for joining us.
Thank you for your time.
We're here with Dr. Cooper, the Superintendent of Alexander City Schools, and again, we've been focusing today on the TigerCHAT program, which is a partnership between Russell Medical, the Alexander City School System, as well as Auburn University's nursing program. And Dr. Cooper, I'd like to ask you, how does a program like this benefit the school system?
Well, it helps us carry out a goal of ours, and that's to help promote wellness across our district, both the students and staff, and to be able to partner with groups such as the Russell Medical Center staff and also the Auburn University School of Nursing is just a tremendous benefit to our school system, and especially for our students.
And we were discussing prior to the interview about the school system strategic plan. How does this play into the plan going forward?
Yeah, one of our action items for our strategic plan that we developed several years ago was to promote wellness across the district again, and that's for both students and staff. And so when we were presented with this opportunity for this partnership, we were just super excited for that, and so we feel like it's just one more piece of the puzzle in order to try to create a culture that's aware of wellness.
Well, again, Dr. Cooper, thank you again for joining us today, and again for being a part of this partnership. I think this is great for the students as well as the teachers and administration to see some things that can take place not only in school but outside of school as well.
Well, thank you for the opportunity to be here, and we're super excited for this program and this partnership, and look forward to all the things that it'll bring to our students in the Alexander City School System.
Thank you, Dr. Cooper. I'm here with Jessica Sanford with Russell Medical, as she is the Community Relations Director here, and we just left Radney Elementary and the TigerCHAT program as they were discussing physical activity with the students in the gym there. And so, Jessica, I think that's a great lead-in to something that's happening nationally in terms of the medical community.
Yes, February is American Heart Month, and so obviously in observance of American Heart Month here at Russell Medical, we do several different things to promote an active lifestyle, healthy living, healthy choices, knowing your numbers. One of the things we do through Total Fitness is obviously we have, and as you heard from Kara and Jack earlier, different types of aerobics activities. We have swimming, we have land, we have all sorts of classes that they teach there in Total Fitness to promote active lifestyles. Also, they have cardiac rehab for patients that have had some sort of heart episode, such as a heart cath or a stent, and that's where you go through a program where they monitor your exercise to make sure that your heart is strong enough and healthy enough to be doing the exercise program that they design for you. Another thing that we do currently throughout the month of February, and you may have seen this on our social media, is heart healthy recipes. We partnered with our nutritionalist and dietitian, Linda Moore, and our executive chef, Brad McFiggin, on coming up with some really delicious and heart healthy recipes, because that's important to try to cook a little healthier. Here in the South, that's not always easy. We also, February, I think it was the 2nd this year, the first Friday in February is Wear Red Day, and we encouraged everybody to wear red so that we could promote women's heart health. Women are sometimes the last people in the family to really take care of themselves, and so it's important to really know your numbers, your BMI, your cholesterol, your blood pressure, and staying on top of that and being proactive. And in that same vein, February we offer several different heart month screenings throughout the month, a calcium score heart scan, which is only $90, and that test detects calcified plaque in your heart. So that's a very important to know if you have any presence of calcified plaque in any of your arteries. We do a stroke prevention screening, that's only $75, and that's an ultrasound of your carotid artery to see if there's any buildup there. And lastly, we do
an echocardiogram, which is just an ultrasound of your heart to make sure the chambers and all are functioning properly. So
That's a lot of activity
It
here,
is, so much.
with Russell Medical. But as we alluded to with Linda, you guys are such a great asset, and we appreciate you guys educating the community on things that they can do to enhance their current lifestyle and better themselves going down the line.
absolutely.
All right, well, thanks for joining us, Jessica. This has been another edition of TPI Talk. My name is Scott Hardy. See you next time.